Where you go, you come. We must tell you, Cabo. for we, make you give we now. Because in the morning we dey ask you, mama, wait till you bring for we, make you give we now. Because in the morning but where you left here, where you go, mama, angry they get we not get nothing for you. Now that make where we see you come, we all don't gladly we dey tell you come.
If you're having credit problems, I feel bad for you, son. 1,000 problems, but a car rank 1. Wills for sure got me. If you're having credit problems, I feel bad for you, son. 1,000 problems, but a car rank 1. Wills for sure got me back in the car. Leasing with my credit, I was like, man, forget it. Who would've thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Fiats, Minis, Renaults, you know, boom, boom, let's go. Wills for sure, car leasing for every credit score.
I found love. Then beside true love was hard to find. Then all life, this love was hard to find. Now the love it tender loving care. You just scatter me head, I don't go insane. Darling, finally, you don't tip me hot like Jota. Darling, finally, all in Bella then go scatter.
COVID-19, especially the new variant, is spreading quickly across the country. This puts many people at risk of serious disease and is placing a lot of pressure on our NHS. Once more, we must all stay home. If it is essential to go out, remember, wash your hands, cover your face indoors, and keep your distance from others. Vaccines give clear hope for the future, but for now, we must all stay home, protect the NHS, save lives. COVID-19, especially the new variant, is spreading quickly across the country. This puts many people at risk of serious disease and is placing a lot of pressure on our NHS. Once more, we must all stay home. If it is essential to go out, remember, wash your hands, cover your face indoors, and keep your distance from others. Vaccines give clear hope for the future, but for now, we must all stay home, protect the NHS, save lives.
Right. Good evening, ladies and gentlemen. Good evening, the Fambulden, wherever you day. Good evening, Kushe, Cabo. Tonight, on the 18th of January 2021, the win-win, the long-awaited 2021 will be the plans for everything. Tonight, we're there with brother, Dr. Achmed, Kamara. Tonight we get plenty for now. But we're here to talk about the corona busting myth tonight. We dey open the bag, we dey loose the bag for let people and see what's inside the bag. Tonight we don't hide this thing. But we get plenty for now. I just want to welcome to the program. If you watch me right now live on Diaspora Voices, we get plenty for now. We go put the number on the screen where if you want to engage with the program, we go put the number up, you go call the studio number or send a message via text. We can read them out, ask you questions then. But before I go further, I will let for introduce we guest tonight when I know other person, a well-known, renowned somebody where they don't do so much in the community and where they still do plenty in the community where they try for educate we, a day into the medical field, and not only that, they help a lot na the charity side as well for make sure say we get well body na salon. This na no other person but Dr. Achmed Kamara. Mr. Achmed, welcome to you, sir. I just want to let you say hello and push your cable to the people then.
Yeah, on Akusha, hello everybody. I'm so happy for the show today. For day with the people and my favorite activity in the whole world.
Thank you, Dr. Achmed. Thank you very much. Thank you. On the other side, as soon as I can see somebody where they can push your hand them and all that stuff, they can move. The technical man behind the screen, where not in the brain behind all this. The man himself, aka DJ Little, the Moses of Salon. Welcome, DJ Little. I just want to say push and cable to Fambulen.
Okay, Fambulen una kushe una kabo. I hope so una all the Yerimi. Achmed Ish, una the Yerimi clearly.
Loud and clear, sir.
Oh, yay! Well done. I'm excited about that. So, me family una kushe una kabo. Today, what he said, the 18th of January 2020 win. Now they pa and I'm glad for dinner and una thank you. I don't like beaucoup question. I hope say Dr. Achmed Kamara get for move in mouth, in brain, in thinking, in finger at faster than Lewis Hamilton. You get for smash all record because they ask all them question here. Plus we people they don't question them back. So I'm glad for that. Thank you, Dr. Achmed, for we join me.
Thank you very much. Once again, I just want to say we privileged tonight to get Dr. Achmed and Dr. Achmed. Once more again, I just want to say thank you for giving the honor, for giving the opportunity for then at this program just with one phone call. We tell you plenty thank you. Right, moving forward, from Musa Sidon, they watch Dr. Achmed. You they glow. The last time when we see you, 2019, where you come, you participate into the first countdown community park run, then to now you're different Achmed. What's in these secrets?
Well, I think you talk about the community park run. You see, from that I attended that community park run day, I just become so addicted for the one park and the run with me them, and during the lockdown, I find that so helpful for the physical health and the mental health. And so I just say, well done, Tona, for boosting the exercise activity at the back. I hope say we will continue this after the lockdown and this COVID thing also will not settle down.
Thank you. Dr. Achmed, waiting change from that 10 day to now, because religiously I follow you. Honestly, religiously I follow you. I can see where then at the surgery, when you quiet, you get your midterm. I can see they do jump and jack and then push-ups and all that. Waiting so change from the last 10 to now. Waiting win all this.
Well, I think sometimes you get forget to compare the reason for anything when you want to do in your life. You see, it's very easy for them to get motivated. Yes, I want to body spa, or yes, today I will exercise, but it's very difficult for them to be committed. And I think commitment is a very, very important thing in any way you want to do in your life. And so commitment, now that's where you don't say you want to do something long after that moment of excitement, and you still they do them. So just become committed to them things that they are trying to incorporate them as part of your life. For do 10 minutes exercise during the lunch break or for going to park, it's much more easy than for plan for going to gym for 2 hours, where at times you come over, you don't tire, you're able to do them. So that's why I try to incorporate them. Let it just be easy for them to do them.
So waiting at the results so you get. How you feel within yourself? Because for me, for man where they exercise, as I see you don't need to tell me whether they take medicine, whether what do you do, but I can tell say there's something where you do where they work for you because you're glowing.
Thank you so much. Some people, you see some people they say, hey, let not be saying that you work in great and you're up. I don't know. I can go inside your own cream then. But look, when you do something and you enjoy and you sort of see the benefits. I mean, we all would give this advice from your own point of view as a doctor, but we therefore practice what we preach as well. And just like how anybody can get any kind of health problem, we self as healthcare professionals can get them. So we also need for take the necessary steps for preventing anything.
Thank you very much. Dr. Ahmed, I want break the ice tag because there's so much rumors where they go around. People and they assume, some people and they talk in a corner but not get mind for like just pick up the phone and ask. We understand say you don't take the vaccine. Is that true, sir?
That's true. I don't take all two the doses of the vaccine. The Pfizer vaccine I need to take.
So you don't take you feel say this the second question I will cancel this corona sickness it was past the flu.
I think that's a very good question. They're also completely different. The symptoms then at the start can be quite similar. In fact, they get a very massive study where they published in America, where look at the veteran hospitals, so people that don't go to the army, and then get good records, and then look at when people are admitted in a hospital with flu compared to when they admit in a hospital with coronavirus, waiting to be the consequences, and the difference is very, very stark. The risk of kidney failure, the risk of organ damage, the risk of long-term consequences until we'll talk about this later, something called long COVID syndrome, and of course the risk of death. All of them is much, much, much higher if you get coronavirus to a severe level. I mean, not to all man can get them severe, but if you get them to that severe level there, and you need hospital admission. Likewise, not all man can get severe flu, but if you get them and need admission, when they look at the two, the outcome is much, much worse for coronavirus patients.
Right, thank you. Well, people, listeners, not really from the man himself, they don't take the vaccine because there's so much fear over this vaccine. Me say if we see there, wait till we read at WhatsApp and all that stuff. Then it's so much that it puts you off. It make you afraid for go take them. As you don't take them, you see don't nothing happen to you. How you feel like the first day where you actually take them?
To be honest, you see, some minor symptoms are there where you can get, and this is very common with any vaccine in general, including the flu vaccine. Maybe get a little bit of an ache. You hand it at small number outside the needle enter. But I'm not get anything else. Some people can get slight fever, but not anything with paracetamol, not well with deal with. I know a lot of colleagues and we don't go ahead and take the vaccine, and so far I know you're anybody who gets anything more than muscle ache or fever. One or two people can be gone for 2 days, but usually not can go on for more than 2-3 days.
Okay, so because we don't hear different stories them and all that. It's possible for you sick twice. Possible for you get corona twice.
I think that's a very, very good question. The chances are low, but yes, it's possible. And we know cases of patients that will be who gets coronavirus, they confirm on a laboratory still a coronavirus, and then subsequently months down the line, they're sick and they get sick again. So it's possible. I mean, the other thing we will know is the immunity where you get following the infection. So then, the protection, the natural protection where you get after you don't get coronavirus the first time. Currently, research shows it can last about 5 to 6 months, right? Other coronaviruses wait on there around where they cause them flu-like illnesses there. So the immunity can normally last around the 9 months, 12 months. So waiting we know is when you get the coronavirus, naturally you're going to become immune for life. At some point between maybe 6 to 9 months, you will lose immunity, and that means you come at risk again for get coronavirus.
So if even you take the vaccine, it's possible for let you catch the virus back.
I think a very, very good question. I mean, I don't see questions there. So, and I think rather than just go straight to the answer, like just shown us something, rather than go straight to the answer, it's good to understand the numbers. Then you see, because when it comes to statistics, even we in the medical field, we can get a little bit mixed up at times. I don't know if you they see this now. So, yeah.
Yes.
So this is
Yeah,
just
Ahmed, just quick one here. I know Ahmed, just quick one.
Yeah.
You mind for increase your volume? Then DJ too, you mind for increase your volume as well, please, for the viewers then.
The volume loud and clear. The volume loud. The volume loud. Any more of this, we go get an echo. So if anybody then listen, then just need for turn up their device. DJ Ish. Ahmed is loud and clear.
I think so.
Okay.
Ahmed is loud and clear.
Loud, clear. Sorry.
Well, I come here. So, yeah. So this now a representation of we all. Now, 100, people in there, so right. This now like we all the totality of we at the moment, where we don't get any immunity, no vaccine. So if we all get the coronavirus, if that virus they enter with nose, respiratory system, we all 100, then peak and then they're ready to do this. All 100, we all will get coronavirus, right? What in WHO says, if you get a good vaccine, it go a good vaccine, a vaccine where they reduce the chance for you to get the coronavirus illness by 50%. So out of the 100, and if we all take the vaccine, only we 50 will get the virus. Will get the infection. So if you look down there, you say, well, yes, 50% will get them, but with WHO in guidance, I would rather take that chance away before say, I get a 50% chance, I not get them. Well, the last one with this Pfizer vaccine, where it gets 95% efficacy. You see what's going to happen? Now, if we all take the Pfizer vaccine, what in the research don't show is instead of this situation when we all go get the coronavirus, now we get a situation like this when only 5 people will get the coronavirus. Okay, in that first situation, we 100 will get the virus, and bottom you will see 20 or so people will get admitted, and a substantial number of them will need for intensive care. Now, out of that 100 day with the vaccine, the Pfizer vaccine, only with 5 will get the COVID illness, and sometimes then 5 and then some will go hospital and maybe just one will need intensive care, and sometimes the signal will be that dangerous as well. So the answer is yes, we're not 100% protected, but the chances for let we get them are much less compared to if you not be taking the vaccine.
Okay. Right. And just like especially we Africans and a lot of other nationalities, this habit of when we go to supermarket, we get for make sure say who come na holes, we wash all the stuff then and all them thing, and they able get, and then if you get pets na holes, because guess what, most of people get pets in holes, you can contaminate the virus through shopping and then deliveries and the pets.
Theoretically, it's possible. Yeah, it's possible because if me sneeze and then cover me mouth while I sneeze, right? Then I go to touch something at supermarkets. Then you can't touch them, and you're gonna wash your hand. You wait your face by mistake, or you something gonna you try for scratch your eye. Yes, the virus will enter you. Now in terms of pets, me not a veterinarian doctor, me not a vet doctor, but I look up some things, and the CDC, Center for Disease Control in America, shows that actually there are cases, you get cases of where pets are not become infected with coronavirus, but are more likely the human beings that they don't infect them, pets them, they don't get evidence of the infection, they go the other way from the pets to the humans, but are not going and take that risk. So look, if we now we get to be pets them. So if we look after ourselves, and then control the pets. It's difficult for people snagging all the time, but you will control them, then chances for them to get the virus will be really, really low.
Wow. You don't give me so much information. Viewers them and listeners them, if you want call and engage, the number is 075 35 44 14 14, and the number then at the screen as well. If you want call for ask Dr. Ahmed questions, something where you feel say you don't understand, something where they bother you, information where somebody don't give you, you don't understand. Now your opportunity is to actually call the program and then engage with we. Why? That takes me to the next question. As we, the African man, then we get so much fear, Dr. Ahmed, so much fear in we that way they tell me say if you don't take this vaccine, we go become impotent, you know, we'll be fertile and all that stuff. Then they, how effective, how to, definitely 100% truth over this information.
Well, it's yourself now, Africa, man. And I don't want to take the vaccine. I don't get any of them concerning it. I not test on it for see if I still able, but but look, we evidence show we don't get any evidence for that. That is the honest truth. I don't think saying that any way you get for be fearful of. And the same go for woman them as well because every says sometimes a woman you go become infertile, you know, we will born, and it's very scary for people, and especially women that we don't ever born picking or sometimes they don't they try and they struggle, then they read anything they are so. But you see, every one thing where somebody that WHO talk, you say whenever there's a pandemic, you get an infodemic, you get a lot of information where when are myths, where you not get any scientific backing, and it's difficult at times for controlling information and it. Hopefully through programs like this and how we said to talk to we loved ones them and friends them, something that will able help for reduce that this infodemic gap. So
Okay, that's a good question, like what you just talked to, Dr. Ahmed, and thank you for all the response so far. We just want to say, when you talk about this pandemic here, and then you dey talk about infodemic, I like that. Because, join me, Google search them. I think yesterday or the day before now, actually come across that particular language there. Now, also, I end up finding out, say, this particular statement, and you go agree with me, one or two, wherein they say lie works, i.e., lying works, especially if you keep the lie very brief and then you repeat them over and over. You understand? But also, waiting the article, they also say the article describe for generate say truth last. But in these cases, but because lie they work, you understand it sells at greater. However, true they last because all you need to do is for be consistent with that true day. Elect the lie they overpower. But if you're consistent with the true in time, people then get for understand say the truth. So I know say you don't talk about you want for just elaborate on that in the context of this virus and the vaccine.
yeah, no, thank you. Very good points. You see, when you hear something over and over and over and over, you mind they begin to believe that. It work for any kind of thing. If you're in a relationship, for example, with partner, they tell you, say, you useless, you good for nothing, whatever, all the terrible words. Even if you don't believe them at the start, after a period of time, you will begin to internalize that belief. The same they go for them kind of thing there. So if you if you begin to tell they listen all the time to they lie and they wrong information and that's not what you surround yourself with. Um, eventually you will believe them. So it's really, really important that we all be careful who side we get the information from. Me, I don't get some friends them where know anything about science or medicine, but they argue with me bit on our WhatsApp about certain information where they don't get. I mean, after a while, I say, look, with friendship more important than that. I just tell them, say, look, I respect your decision, this now, so we stand, and we change the conversation. If I get anything useful for tell them or message for send them, I send them at a later point. Um, so we'll continue for go to the resources them we trust them. WHO, CDC in America, you get the NHS England, get a page now. So even the direct.gov.uk, get a page, you get so many useful information. Even, trusted news outlets like, BBC, the reputable ones get credible information. But even the news, you have to be careful as well how much of the negative news you look at because it can paralyze you, make you not even come out. It can make you not take any action. You're afraid for left you from that at all.
Wow, thank you, DJ. So that are brilliant points you raised. So, Dr. Ahmed, a lot of people, a lot of we, because face mask, it don't become mandatory now, it becomes here, except for people that were exempted. How long we for use with face mask? Because we get some of you not to know, we can put on the morning, from what put on the morning, don't be cyber, we go, say we're ready for off back, 8 hours, we'll cover with time, you know?
Yes, and I know there is some people that when they come back now, that surgical mask and the ones are back for the next day. Yeah, so look, with the surgical mask, you have to look at waiting the manufacturer guidelines, but most of them, for wearing them for longer than 4 hours. The good thing is, and difficult, if you're the work na a healthcare environment, or you work in place, not they provide them for you, it's difficult for them people and get them. But most of the supermarkets and they sell them now very, very affordable. Ideally after 4 hours you can pull out. I mean, if you just get for squeeze somehow, I think you could at least try for change them, once a day. Not for the where and beyond that. Now the one day when we tell her that they make, there's no scientific evidence about the one day in terms of how long for them. But I think same thing, if you cannot host, you wash some, okay, before you reuse and the next day it will help for reduce the risk of let you not self-contaminate yourself as well.
So Dande, Dr. Achmed, Dande now for the personalized face covering, not for the surgical mask, where you go see now you hospital setting or you care home or anywhere where they carry out clinical responsibility.
Yeah, the personalized one. So this not for the surgical one, or not for WhatsApp. Where you use them, that's it.
Because we don't see then they sell on a big market in a salon, and they West End, Congo market, Bombay street market. Then get the people that were dedicated for just go pick them and then go put them inside soap water and get a good scrub. Then they use peg and then peg them up and then go back down Bay Junks and then resell them. How dangerous can they be on a serious note?
Look, it's very, very sad, it's very difficult, and I know say them people and they do that because they don't get an alternative. Governments not provide them for them, so they try to do the best what they're able to do. But of course, very, very unlikely for be effective at all. It better set let you maybe just get you personalized one way material and you able to wash them and it still will be robust than surgical one in there because even before you wash them, they say not use them for more than 4 hours. So imagine you don't go be in this rubber and somehow. The integrity not will be the same.
Indeed. Well, anyway, Ish, just quickly, if anybody they watch right now, obviously now me and Ish, now we normally fire the question to Dr. Achmed, but like we said, this is not about me and Ish. Any one of you can ask Dr. Achmed any questions. So if you engage, I don't for pass the news and share them. So when I say can help we now and when I say can share. All me number they were again and me contacts. I don't disturb the all me don't exhaust. Each don't disturb. Dr. Achmed himself don't share. So all the people them. So when I say do something, when I help we when I share them because this is not an education program, as each say, we they bust the myth on coronavirus because we all want to know the answers to them questionnaire. And the best person where we get now we community for provide the answer for we when are we on NHS GP frontline worker in self. Now we get to this now. So when I don't waste this opportunity, when I ask them any question, they ready for gonna the answer The question now 00 sorry, the number now 0044 Again, the number now 0044 Then they go put you straight through to the line where we go link you, and then you go ask Dr. Achmed any question where you want. So please, please, please. And also later on tonight on the program, I get a surprise for now. So if you follow me on my status, when I go see say man like we will not afraid the needle, we go take a mbembe and chukui. But now that civilized kind chuk, not that bad kind chuko. You understand? Because some man say me and I go chuk me with needle. What is the word now chuk? You are big before DJ is carry on. That word day, I know say now we don't use to and Creole Dr. Achmed. What in the word chook? Because I know other person they go scare me, say, I know other they go chook me. You understand? It's if you afraid the word chook, not use the word chook. We don't know this part of the world. We all the Western world, as we can say, Australia, America, China, UK, and so on and so forth, Europe. You know, even if it's a salon, we don't delete that word they chook. Then you are going to be vaccinated. Then they go give you injection. You understand? Well, Dr. Ahmed, when you say, and they go to me, doctor, let them go choke me. Because even at this UK, how they so, we get with brothers and sisters when they say, I don't go let them go choke me. Do you how we can avoid for use that word they choke? Because I'm not saying that world born meet and raise up for. Because that necessary can scared man. If you can respond, please.
Right.
Oh.
Thank you,
Yeah.
aka the Moses.
I just see because I mean they see for if any questions that they come up on the Facebook and they see a lot of people and they struggle with the volume. I don't know what we need for me. I think that they look the Yeri DJ little well. Now the feedback that's what I get. Anyway, I don't know what we need to do.
Okay.
I don't know. I think me on volume, they're 100%.
All right. Let me.
Yeah.
Okay. Let's go. I think so. We're better now.
Okay, thank you, DJ Litsu, thank you. Right, Dr. Ahmed, this now a question we on the go now for quite a long time, you know, because when we know you be there at the hospital, and then you decide for move, for take a huge step, say, you know, I don't want to deal with the crowd again, I don't want to deal with the headache and all that stuff, then I want to engage with people and one-to-one and sit down with them. And then know what's not a problem. Give it that 10 minutes. I don't say sometimes now 5 minutes they can get rid of you. But with you, I don't say they interact with your patient then. You give them more than 5 minutes. How you find they want to the surgery that how you find the surgery with the hospital? What's give you that mind of change thing for going at the surgery?
Yeah, that's good question. You know, a major career move for me because I've been work towards becoming a respiratory physician and we just get a few more years for become a consultant why make that move. The big motivation really the kind relationship where one gets one with the patients then and the things and way I want for what they do outside of me NHS work. So the charity work for the Rona Salon and I say as a GP it will, you know, for being a GP will allow me for combine their activities with them. And you see, they say 90% of doctor-patient relationship they actually happen at GP surgeries, and only about 10% they go on for holistic doctors in our hospital. And so a lot of patient interaction they happen at surgeries, and in Southeast London, which I do a lot of the work. You know, it's so nice where somebody come in and say, oh, they can't see Dr. Kamara, get on, I mean, when they come, they don't even know me, I don't know them, when they come and say, hey, I'm behind a second. You know, but likewise, you will get something a Nigerian person will be able to talk the broken English. You know, I able maybe, you know, listen to them and get and concerns and help them in perhaps in a way where somebody else not able to relate to their culture, they will relate to them. So they get a lot of fulfillment and joy from that. I really, really enjoy that. I really, really enjoy the work as a GP at the moment.
Oh, thank you. Because this now something we don't go now we aid say, oh, okay, Achmed they do so now, you don't change now, GP surgery, they work and all that stuff. Why? Ahmed, a lot of we they take vitamin C, vitamin D, we they take vitamins in. Say this go work. You understand? This they prevent you from having a corona when you take your vitamins in. That is still prevent you.
No, so look, it help for augment you let's say your immune defense, right?
Okay.
But it doesn't stop you from getting coronavirus at all. We don't talk that even the vaccine not 100% protective, but it's very they help a lot. We know for say vitamin D and vitamin C that they help for boost the immune system. So it's good for take them, but not take them at the expense of doing the social distancing, washing your hands, and wearing of masks. You still need for duality and still need for just follow whatever the public advice, whatever the public advice in your local area outside there.
Oh, thank you. Right. DJ Little, I don't know if you get any question for Dr. Ahmed. Or again, listeners, una way to watch you. If you get any concern, you get any question we need for us, please feel free for us. And not so only for watch the program, share the program that you platforms in. These are diasporal voices. I mean, we did bring candidates to you. These are once in a while. All the questions and all the things the way they go and aid, all the things the way they read. You understand? We get a perfect opportunity to read. The man himself then I have to answer all them questions in a day. So let me make use of this. You can call the number, go to the screen and look there, call the number. Dr. Ahmed, a lot of people right now we don't lockdown, but few healthcare workers and key workers and they send them beginning at school. You feel say it's safe for sending beginning at school?
You see, a very good question. And ultimately, government and public health, England, and we as individual parents, we therefore balance the risk. You see, there are risks between, well, if we tell all the healthcare workers and personnel that also look after them, picking them, then Ura go they for provide the service where the whole of society need at the moment for look after patients then. So I think this is not the balance. But then if you look and say, well, if not only healthcare workers and people they go, then you don't reduce that social interaction for them people in there. So the risk for that you will get or let people will get any of the viral infection significantly less. Beginning, of course, to get coronavirus, but thankfully, on the vast majority of cases, the symptoms can be very mild, not normally need for even be admitted to hospital, but some can be admitted, some can get serious, complications, some people can need intensive care, just like how adults can need intensive care. So, not a light decision at all. It's very difficult. It's a very difficult decision for healthcare workers, and a difficult decision for teachers. Then, the beginning, of course, some may be very happy because they get a chance to play with their friends. Then, not an easy decision.
Interesting. And well, as you know, just like what you just talk, within we own community, we get a very young, vibrant community where we get young parents, them so to speak. We all are one of them, and that anxiety level still they cut across, and you they see how reflective. But the other thing as well is the fact say the parents them go want if the picking and then are host because of for let them actually ensure say them picking and they then learn but the same way because proper monitoring we get this mindset as a learner where we believe say where you go away where you in front of the teacher now you they learn better, you understand. That's all they add to they arouse the anxiety, so to speak. Waiting the parents they need for do from an education. I know say you know to school teacher, but it's not school teacher question regarding a doctor. Waiting the parents they need for do for make sure say not even if you choose not for send you picking go to school for coronavirus reasons or and you're a key worker. Waiting parents they need for do for make sure say when them picking and they do home learning, they actually get the best out of that.
Yeah, no, very good point. And Mr. Pierre picking them and Jens have been at the same situation. He I will tell you from my own experience, I think forget a routine really, really important for the beginning. You see, for making them they still wake up in the morning, for them they, do the work way. Most schools are now they send work either online or they can get them online tools and whether they use whether Shogi or Google Classroom or whichever one, then they let it begin and they engage and and they monitor the beginning because look, even with young beginning, if you beginning very clever and the brain will always want to do waiting at the easiest things, right? And waiting not to stress the brain too much. And for Sidon and they play games, it's less stressful than before. They begin to do 1 plus 1 or 2 times table and with mathematics. So if you know they watch them, they're very smart. They will sit down there, they play games. They're happy to be picking them. And at times, I can catch them out. But I only able to catch them out, or my wife will catch them out if they monitor them. And then they'll get back to waiting in the do. And therefore, look, strive for being, and this is an opportunity for letting you bond with them as well. Anytime I did that was if I did exercise, I will get it and let us can get a little bit involved because the routine don't change and it can be so boring for them. Okay? Take a 20 minutes, half an hour break, jump up and down or whatever exercise they do for get some oxygen, they flow through them. When they go back to their work and we will concentrate more.
Fantastic.
Yeah.
Okay, just one more for me for now, Dr. Achmed, and we do well so far. People they move now, they watch we and Koke Moba say, then you hear me more clearer. But me they monitor as we speak. Okay, as I say, during me own monitor, it's very very clear. So I don't know whether now you device or whether this now generic across. So if anybody else apart from Koke, they experience volume issue, let me know that volume issue from either Dr. Achmed or DJ Ish. But I believe say from me monitoring, even when Dr. Achmed and DJ Ish they talk, I get clarity. So I want to move to my next question, Dr. Achmed. Obviously, we get some people then they way don't suffer and will be extremely sick during the first wave of the pandemic, and thankfully they make a recovery. But also we can learn of this new term what they call long COVID. Do you are waiting a long COVID? What does that mean? Long COVID.
Yeah. Now, very good question. This one of the you don't get the coronavirus, you don't recover, but the recovery not just stop from that same way they stay well in hospital. For some people it can be okay. For other people it can go on forget breathless, persistent breathlessness, maybe because they get a respiratory complication. Some then they can get joint ache, some then can get significant, lack of energy, what they call fatigue or tiredness. And some then they can get joint swellings, then both in the arms, the joints, then the elbow, wrist, knees, then they have, some they can get psychological problems. Some they can get, what they call pins and needles. So the system now a multitude of symptoms. Not to all man can get all 10 systems a day, but you will get, not saying a constellation of 10 systems a day. And, the management, to there at the moment, of new phenomenon, and they do active research on them. Sometimes you will need a psychologist because it can affect your mental health in quite a big way. Some people they end up require long-term painkillers. Sometimes they're not able to go back to the same level of physical fitness when they get before the infection. So this kind of long COVID syndrome, it can really, I get a lot of patients that it all really cause a big change in their life. They're not able to do the work what they did before. They're not able to take part in sporting activities that what they did before. So, this COVID thing has always some man can say, well, not so all man can get some bad one, but at times you can get some bad one to the point where you need intensive care, but it can impact you long term. It will change the quality of your life.
So waiting a long COVID sufferer need for do for improve in lifestyle and well-being and for try for overcome that long COVID sickness day?
Well, it depends on, like then what those symptoms and what I talk about. It depends on which one of the symptoms that you get. Some people that maybe a psychological problem they get, and so they will need some assistance from a psychologist, but also you get to work on your mental health as well. Read something positive on a daily basis and try to boost the mental attitude to a positive one. Easier said than done. So they can get joint pain, and it can not be straightforward whether or not a true rheumatological problem, where you say you need a rheumatologist and then specialist medication, or whether or not just joint aches and pain because of long COVID syndrome. You therefore gradually they get yourself back to getting into exercise, but you know where we go from. Looks like they now after COVID. If they run 5K a day, you know where we will go and then go challenge 5K straight away. You therefore take baby steps and gradually improve yourself. And sometimes you have to accept, say, this is not a new reality for me. I know we will run 5K, but maybe if I ever get to 1K or 1.5 or 2K, then there's still improvement. We're not sitting on our own. This is number one thing. Not sitting on our own. So a lot of people can suffer because they say, well, you don't get COVID again, you're not so breathless like you need to hospital, but they notice they sleep like 16 hours a day. You don't know why. You eat, but you feel so lack of energy. You go to blood test to the GP, they don't see anything at all. That's not know where waiting is wrong. When you start on waiting is wrong. See the doctor, we get a lot more information about COVID centers and everything. King's College, you get a center where they manage long COVID, and in fact, you can even go on that website as a patient, filling the form yourself, you don't need a doctor to refer you, and you can refer yourself to the service, and it will give you a lot of support and advice for managing long COVID symptoms.
Thank you, Dr. Achmed. Thank you. Again, listeners, when I make use of this opportunity, if you want to call, the number being on the screen waiting for call. I call the number again now, 7535441414. Call and ask the question. Dr. Achmed there for answer the questions then. Dr. Achmed, I get this question from a friend. It's happened at us with Peking, and they live stay at the same house. The Peking positive, she was hospitalized. It came again for catching corona back twice, but at the same day. But the mommy being there for free, he self-isolates. Then when you do the test, there's nothing wrong with her. It's negative. How possible?
So the fact that the mommy not get the test negative?
Yes, the mommy not sick at all. There's nothing. And I don't see them at the same house. I don't see they live together.
Yeah. Well, look, just because they live high, so when you get the infection, they're in close contact with somebody, normally say you will get the infection 100% of the time. Right? But the thing is, you don't know whether at this time you will get the infection, whether at this exposure will make the virus come to you. So, I mean, it might be absolutely the right thing for self-isolation. It can be very difficult, a lot of we there with the parents, we can have multi-generational household, and at times we can be a little bit overcrowded now with those things. So, but for self-isolation, not going to be easy at all. But if you therefore try as much as possible whenever you do that self-isolation, because you don't know whether at this time you will actually get the infection from somebody again.
Okay, just give me a line. Give me a line. I can put you through. You want to talk loud?
A lot of people first when this thing starts,
Hold on,
say,
stay on.
the corona and all that hot country. So now we decide, if you know how it say it didn't exist inside the day. So we decide to go salon. So okay, let's corona not in a salon because of the heat. How scientific proving can it be?
DJ Ish, DJ Dr. Achmed. Dr. Achmed, I apologize for just interrupting her. I get a long distance call, and I call her one day on the line. So he just want to make a comment, not a question. He just want to make a comment. So we go try to put the caller through. Caller, waiting your name and who say the call from, please. Hello, caller. Let's try and get the caller back online and see if I can able get the caller. Bear with me. Hello, caller.
Yeah, can you hear me?
We hear you, and we don't know whether you hear me.
I can hear you now. I can hear you guys.
You hear me very clearly, yeah?
Yes, very clearly. I'm struggling to hear DJ Ish and Dr. Kamara though.
Apologies for that.
That's okay.
So waiting are you comment?
Okay, so basically, my name is Maria too. I call from Reading, the Royal County of Berkshire. How do?
Fine, thank you.
Thank you for putting on this show, yes, so.
Una de hear Maria too clearly.
Hope.
Okay, go ahead. Sorry.
Yeah, we just really hope for say a lot more people in our community could just tune in because this is so educative. Like the one I listened to last week with Isa Tadem, it was absolutely amazing. I didn't lie. I mean, I'm one of the people I was quite skeptical about the vaccine. But obviously being a frontline worker, not in the medical field, but I work with vulnerable children and families. And I tell you what, it's been so difficult working from home, not actually having to be able to see the kids that I work with, the parents, because they get a real sense of what's really happening in their daily life until you're sitting physically next to them, and I miss that. So for me, I can't wait to get back to work, to doing what I love to do, rather than sitting on my laptop and just doing it from there, because for me, it doesn't work for me. So basically, we bought our put we flew for the vaccine last week, and within like a couple of days, we all get text them. Me get me own text, I think yesterday, for book the vaccine. So I get me on tomorrow, and actually, to be honest, I'm quite excited to go and get this vaccine. A few people who I don't tell, have been quite negative about it, but I need to look to them people in it. I've done my research. I've listened to medical professionals like yourself, Dr. Kamara. I don't listen to Isa Tanyon last week. And plus, the man of my heart, my father, has taken it, and he's fine. Anybody who is for say my dad is like my heartbeat. So if you have 5% will take him, I'm going to take it. So I just really want to encourage you people when they listen, and you want them hopefully people can listen or will get this message also. Please, please, please add it, take God big one. Not even for yourself, right? But for your children. What are you teaching your children? For me, so I get two picking. I got a 2-year-old and a 1-year-old, right? Listen, I want to live long to see my children's children. I don't know about anybody else, but there's been so many myths about, no, go take them because you go turn like so, you go look like this, you go look like, listen, we got in some can't make you go. Regardless of what the long-term effects might be, we all don't take vaccine. A few years back, when the flu vaccine came out, I take them. And yeah, I was a bit poorly because I had flu-like symptoms and stuff, but that passed. It did pass. We picking them, we vaccinate them. So with everything, there's risk. As I don't know what I've been talking last week, even when you take paracetamol, there's risk that you might be allergic to this or you might have a reaction. It is what it is. You just have to go in there knowing that you don't do it you need for protect yourself. Yes, the medical people can do what they need for do. We Prime Minister Boris Johnson can do it in for government can do it in for, but at the end of the day, it is your responsibility. And I think that's what people don't understand. It is your responsibility to look after your own health and those you love and the people around you. So I dey beg with people because beaucoup people anyway don't die of this corona, and corona is real. I know because my father corona nearly took him. So I know that it is real. The sad thing about when you person is sick, you're not able to go see him. That killed me. And I tell you, if I don't been picking them, I won't feel that I don't want to say, whatever happens, happens. But again, I had to think about my children, because if anything happens to me, God forbid, what's going to happen to my kids? So me, I just think with the big people, do your research. Don't just listen to the medical professionals. Don't just listen to Zainabu, Abibatu, whatever. Do your own research. I've done my research. Look up on things. There's loads of things online. .gov.uk, there's loads of things. Talk to people who don't take the vaccine. I know quite a few professionals who don't take the vaccine. I don't talk to them. People that are close to me, I don't talk to them. So I don't fear about what might happen, what might this, what might that. You know, you get to weigh up the option then. What's more important?
Thank you.
So me, I didn't go take my vaccine tomorrow.
Well
you
done.
know, and thank you guys so much. You guys are doing an absolutely amazing job. Whatever we can do to get the word out there to our people, let's keep on doing it.
We appreciate you. Dr. Achmed, I will go let you come and buttress waiting Sister Maria to just say. Sister Maria too, great call. Thank you very much. And we hope so you go continue for listening to the program and share to you people there. Now the royal town of Berkshire and extend with greetings. Okay, bye.
I will do. Thank you so much. Bye.
Okay, people. Dr. Achmed, if you can come in and just buttress on that, please.
Coronavirus. And we don't talk a little bit about some of the things that will happen. Long COVID now, devastating thing where where we get treatment for now just supportive care. Some people and they go in the hospital even when they survive, they're not the same anymore, but they don't get a complication with their kidneys, their hearts, their lungs, and they will breathe properly. Sadly, you still get some people that where they die. Very, very sad. And we know, and I'm sure we all have a community now know somebody where got lost in life, or you know somebody where knows somebody where got lost in life, and they lost in life. So, then we know that in the vaccine, really, now the closest thing where we get to the cure at the moment of coronavirus, and the closest thing we will get to the cure. So if we get the opportunity, and by August, based on what the government said, every adult in England will receive the vaccine. So they will offer them to you all. I will say, and also by force, some people that will still excited and all that, but if the vast majority of them get the vaccine, and we get, I think it's over 70-80% of the population will get the vaccine, that will really, really help to stop the spread of the virus. And that's really suggestion of that lawyer for herd immunity. This one we'll talk about later.
Right, Doctor, thank you for the both meeting. We call her just say and again from a health professional. What's in the advice? Because lately, from when this thing starts and all that, we were not so healthcare professionals the way we look up to now as we own people that wait for giving knowledge or guidance over this. But we see say the people that within the healthcare sector, the behavior of them over this pandemic is so appalling. It's not encouraging to some of we. Waiting at the advice, you as a doctor, where now they see patient and they actually give this vaccine to people there. Waiting at the advice you the way you want to give them. Dr. Achmed, you hear me? On mute.
Yeah. Okay, you hear me now?
Yeah, it's loud and clear.
I just changed, so said this will be a little bit better for people that were not hearing with. Yeah. So, if you make a very good point, DJ H, just as I will transition, what's going to be the exact question for this?
The people that work at the healthcare sector, lately we see they abide to the rules and regulation of the government. Wait for the giving guidance, but we see down at the organizing accidents, down at the meals, down at the grids and all that. I mean, like for within the medical sector, we people now for the advice. The message is we want sent to your colleagues then.
I think a very reckless, to be honest. A very reckless. Anybody where he wants to know better. And by now, not just we healthcare professionals, but yes, I think we get what be judged at a different level compared to the rest of the public.
Yeah.
Because there are double standards. You know, one day you go walk in a hospital and they tell patients they say now for wearing mask, no go follow it in the government to do, and then when you like hospital working place, you go out, you become somebody different. I think it's really reckless. But we're all human beings, right? We're all human beings and people have to make mistakes. And now, we can't undo anything that happened. We just have to try to do things in the right and proper way now going forward. Because people they look up to me. But if you say, well, this person when a healthcare worker doing up to know better, they break the COVID rules, they make vaccine, they go socialize, in a way where they make everybody else relax. It will make people lose confidence in waiting the public.
So they ask questions, but una doctor, actually, una way they tell you to corona day, but una they mingle part as we they try to convince say yes it's real. So in a way, una they make you confused. But when you say mingle,
when you say mingle, like what do you mean so? Like for one party?
Parties, dinner, meeting friends.
Well, I mean, to be honest, I don't say una when I don't healthcare professionals, I say some people like do that. And of course, if they do that, they're breaking, they break the rule. You break the rule. And not just because now rule, not because it did it for purpose. You see, when you in close proximity to people and for a long period of time, the chances for letting you pass on the virus are very high. And a lot of people they don't get symptoms. They don't get symptoms at all. As I'm saying, will get them bad, but that makes just the way they pass the virus on to it will get a terrible illness. Also, if you said no will get them, but then not also somebody will get diabetes or other underlying medical health problem, it will get them. So I think we all just get to be very, 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 very stringent and strict with following the guidelines at the time. Hopefully, as more people get vaccinated, as they get that herd immunity rate, will try to achieve, they will definitely begin to relax the rule. Things are not going to stay like this forever and ever.
Well, thank you very much, Dr. Achmed, for throw light on that. Again, for people away very, very tied onto like the religious practice and all that, where some of them are 50 years, 60 and above, where the government, then GPs and actually reach out to them and say, today, tomorrow, you get an appointment to go take the vaccine. And then they consult the imam and the pastor, say, hey, they don't tell you for go take the vaccine. Then the pastor or the imam say, no. You feel say it's that idea, it really good for tell them, say, not to go take the vaccine?
Well, look, you see, we all get various affiliations, and of course, we all get such high regard for landmen and pastors, and so look, with the imam and the pastors, and they get a responsibility for help for curb the spread of coronavirus. And to be honest, a lot of them they do very well, and they hold services and both, church and mosque, and the whole services and prayer meetings and through things that they do. And the more we do that, the better. But I think, you get to that at the end of the day. Right? Now you get to think about what will happen to me if I go expose myself to coronavirus. Incidences and way people are not catch coronavirus, because they go to gatherings and like that, or because maybe, again, the other situation as well, now where you can go for very people, so, but a lot of restrictions are there around that at the moment. So, the imam, the religious leaders, everybody in fact, we all just get to hop in and try to do the best we can and support the community and people who get in society, for do they look up to them for leadership, for let them all follow the rules and regulations.
Thank you, thank you. DJ Litu, DJ Litu, I don't know if you have anything we want to ask Dr. Ahmed.
Carry on, sir. Thank you very much.
Okay. Why? From the listeners, if you get any question for us, this is your opportunity to reach out to Dr. Ahmed for make sure say you ask the necessary question away for us. You know, this is the opportunity for us, Dr. Ahmed. Why? Dr. Ahmed, I know say a lot of people can ask say, if you healthy, you did exercise, the possibility for you get for you get the COVID 99%. How true is that?
If you're healthy and they do regular exercise,
yes,
then the possibility for you get the coronavirus.
You mean for let you not get some, Ishmael?
The chances are very slim. Okay. How true is that?
No, so it's not true at all. If we're on 2 days on site and get the same level of exposure, we also get the same chance for let we get the virus. Okay? What it can be different is, well, not all man can want for develop symptoms or for develop a severe case of coronavirus. And you know who will go on and develop that. We don't see athletes, famous athletes, and they get coronavirus, and therefore some need hospital admissions and they don't need hospital. Of course, with any illness, the fitter you are, the healthier you are, the better your chances for fight the infection, the better your chances for you survive any serious illness. So, you know, not confuse the two. So, because you're healthy now, let me say you don't get coronavirus. You can get some, you can get some severe one. But if you're healthy, you're more likely for getting a better recovery from the illness.
So, in other words, waiting that you advise pretty good to people and we they look after them. They engage in no form of exercise, no activity. They're healthy. Their diet's very poor. You encourage them to make a U-turn this particular time, and then just repeat or revisit them their health and well-being.
Look, this what I can say to the patient them is just like how Boris Johnson they said, let's take back control of our country. This is not a time for take back control of we health, right? It's not an eye opener and a chance of an opportunity for let we all engage. Let we all know some people in the past they get diabetes, blood pressure, or other conditions, chronic kidney disease. They don't know say they get them because they know they go for go test. And then a country where they get the opportunity for let them go test, check their blood pressure and do some blood tests with their GP. They don't do that. So take back control. And we all know say, you know, diabetes, high blood pressure, kidney disease. If you get time, you outcome from coronavirus much worse. If you're also overweight to the point where the excess weight they cause a detriment to your health, what we call obesity. If you get that, you know, it affects your health bad as well. So this, I mean, you know, it will lose massive amounts of weight overnight, but at least you can start the process for get healthy, for eat healthy, for exercise regularly, and gradually, you know, and get to a healthier weight. Even if you not go down to a weight and call quote unquote normal weight, but if you're even able to lose 5% of whatever that your body weight now, it will help you significantly.
Okay. Thank you. I think DJ Little, it's all okay now, the sound and all that.
Yes.
Well, DJ Little, I don't know if you get anything we want to ask Dr. Ahmed.
Yeah, I got a couple of questions then what I want to put to Dr. Ahmed. But first of all, I want to say thank you to Dr. Ahmed for absolutely being so clear, being so honest in terms of trying for deliver you crusade. As I said, this is not crusade, Dr. Achmed crusade, now they take place so. And together with that crusade day, we there for showcase, for let we give you the platform, we let we give you the megaphone, for let you showcase you could say, so that we community will become more empowered. So I want to say thank you, God bless you for that. But I got a couple of questions that were put together. One of the questions that I want to ask first of all is, we know say some of we were working at the healthcare settings, then would they become either contact of people that will get coronavirus, or even within we own household, would they get family members that will become positive of coronavirus, then we they become contact. Then they ask me for isolate. Then when they say can isolate, then we they flout the whole isolation rules. We need to take us seriously. And that's why I use the opportunity to say, I want to load me freezer so they can go to East Street, or they can go Peckham Street, or they go Shoreditch, or they go Birmingham, whoever city then they. Or alternatively, but I'm not going to what they do. La go meet with me paddy in paddy, or me brother yanda. Lord just go get a quick talk because I'm bored now host. Even though when you work place, don't tell them, say let them self-isolate. Do ya stress the message again? Waiting self-isolate mean, and why make anybody where they don't ask say for self-isolate, let make it take them seriously, especially the one the way they go and come back, where they travel back and forth from any other countries, them where the government don't say where you come you for self-isolate.
Yeah, no, thank you so much. This is a really, really good point. And no, for let this be successful, it depends on a huge amount of trust, because nobody know go watch you now for see whether you self-isolate properly. You see, at times it can take, if somebody cough in front of me right now, somebody who gets coronavirus, he cough in front of me, then all that virus they camp at me. At times it can take maybe even up to 7 days, 10 days for that develop symptoms, all right? So you cannot get an exposure, you don't know say you get them. So maybe 7 to 10 days. This is now the whole principle on which the quarantine or self-isolation based upon. And so it's really, really important when they say self-isolate or quarantine, that you follow the measures. You follow the advice, and really what you get for do is, as the word say, now for then house. Not policeman they go there and go tell you say then house. Now you get for self-isolate yourself. Yes, easy if now you want and you desperately need for go get some dinner shop. But this is not time where you reach out to your contacts, you reach out to your networks, you reach out to your neighbor them, reach out to your friends them, and then get a lot of places them around London and get community WhatsApp group on next door neighbor, something they call next door neighbor. If you look that up, you will get a next door neighbor group for your area, for your postcode area, where you can search and tell and ask for support, and people and they just want to support you. If you get so stuck, people can cancel their GP for anything, for a lot of things, because we can get a lot of information, not necessarily medical information. Call through to your GP surgery, speak to you, the receptionist, then will give you some advice. If you're self-isolating a host, where not so you want dinner host, you're there with other people, then you get for try as much as possible for dinner your own room, and isolate yourself within the host, because the other people, they don't get others time for go. They just get for the normal. But you then are host, and then try for help you as much as possible with food, WhatsApp, all that things. And then when I get a clear agreement, when they go use the bathroom, and then when they're done, people they get for disinfect and wipe the handles and wash their hands and all that things. That is really, really, really important. And I can always tell people also, when they self-isolate, it don't mean say you get for give up and say, look, I am, this is the end of me. Think about Nelson Mandela, where they in a prison for so many decades, at times in solitary confinement. That is the extreme of self-isolation. But what people they do, they keep yourself active now in mind. They read things them, they plan, or they exercise. So we also need for keep with mind and with body and well looked after. Read something positive, listen to something positive, exercise, go on YouTube, maybe listen to DJ Little or DJ Ish, the music they put on YouTube. I don't say DJ Ish get exercise routine they on YouTube. Listen to them and follow the routine then.
Okay, listen, we can go pan some quick fire questions, Dr. Ahmed.
Okay, we'll
Some,
make them quick, yeah.
yes, now go pan some quick fire questions, right? And this now the real meat busting question them. Okay, yes or no, sharp one, cut and quick. Okay, like pencil way more sharp. All right, so the first one here, if mosquito bet you, they get a coronavirus.
No, we don't get any evidence, any research evidence yet.
Okay. So if you use hand dryer or that ultraviolet light where you can use, where you can see in them bathroom there, it kill the coronavirus.
No, it doesn't kill the coronavirus. You know, there's no substitute for wash your hand with soap and water. And ultraviolet light can cause skin damage when you expose yourself to them for long periods of time, including skin cancer. So therefore, be very careful. Yeah, so you know, in order to stop you, look, if you get an option, if you get a choice, for use a hand towel, especially in a public place, or use a dryer after you don't wash your hand. Use the dryer where you don't get for touch anything, where you just put your hand on the normal for dry your hand, not for kill the virus, not for let you know contaminate yourself. Okay, fantastic. Okay, quick one. Ish, give me some time. So if I take any disinfectant, okay, not promoting any particular product, things like Dettol, bleach, or any other disinfectant where they out there, you understand? I use that they constantly say for the wash, me body, me picking them, everybody will go for wash, now morning they will wash back in the net with Dettol. Then they kill coronavirus or they prevent you from catching coronavirus? The short answer is no. We community elect Dettol, and even if you go on Dettol their website, they say they don't get evidence for that because they not test Dettol against coronavirus. Which they advise an alcohol-based gel.
Okay, fantastic. Ish, one more. I got two more actually. Dr. Achmed, you're doing very well. Okay, listen to this one here. So I asked me cousin, or me brother and wife, DJ Ish. I said to DJ Ish here, look, I know you feel well. Get you a wife for cook hot pepper soup for me. And the way they cook the hot pepper soup, add the ginger there. Add the other bomb or then they put garlic back, let the garlic to my saute. So where I say hello, then they smell the garlic about 4 miles ahead for me mouth. All that they go prevent me from not catch coronavirus.
It's not going to stop you from getting coronavirus, but it could forget a good nutrition and eat healthily if you know they feel well, you know, but it's not going to stop you from letting you not get coronavirus. So don't eat anything a day and say yes. I get all the protection in the world and go face the world without, you know, a mask and washing your hands and things like that.
Okay, me last meat busting quick fire question before I go make Ishmael ask the other question. We now number 26, an important one before we ask the last question and round up for the night is me shoes what they wear, me trainers or me shoes what they go work with, the sole what I can reach now house. I don't buy so many disposable soles them. So I can then get these new shoes. Are they unstrap the bottom of the sole, la wear other sole because even the top of the shoes are they come and find one la know it. Do you coronavirus they pass na me shoes or me trousers or me clothes or I beg help me, I don't know because it's not in the way people don't talk about say well then you shoes that's the way they take go walk. So when na this year if I forget I go get them. Me clothes what I wear for go walk. If I go catch I go catch them. Do you go get coronavirus through your shoes, your clothes and all that thing in there?
Well look again, may I go with outside the evidence they will not get strong any evidence pointing towards it in the way we don't come across. But in America, like just say something, they get studies them where they don't look. You know where you want cross that traffic lights, the button the way they press for let the green man come on. And do swabs them from them and then find out say coronavirus day on anything day. Right? So the virus can survive for a period of time. But you know, I think look, we'll just have to be sensible and practical. You know, me say if you know what you can do, what you can house, maybe pull your shoes now. Pull your shoes at the front door, and before you begin a mask match, you know, mop more regularly and hoover more regularly. Then wipe the handles, the door handles, and be practical. I mean, if you don't come out, you don't dare around people, where you can maybe take your jackets off at the front door. You know, there's a lot of unknown. I know we can't say yes, absolutely no, because we don't get scientific evidence, but we just have to be practical with anything there. So.
Fantastic. So you already drink alcohol. If you continuously they drink gin and tonic, the real hardcore liquor, the sassman, as we can call them. So then they prevent you from letting you get a coronavirus. Ish, now my last question, and then you can ask
Not
question
prevent you,
26.
but it will probably make, if you get coronavirus, the chances of survival will be very low because you will get a weak liver, and your liver now in they make the protein them where they make you immune, your immune cells them. So if they drink and get a liver problem before you will get coronavirus infection, the chances for late survival will be low.
Thank you.
Wow.
Okay, Ish,
Thank
over
you,
to
thank
you.
you, thank you very much. Dr. Achmed, if a possible for let 2 or 3 years old baby catch coronavirus?
Yes, if possible, very, very sadly possible. The chances then very, very low. And a lot of people now when they get coronavirus, now they get severe symptoms. But a lot of information they come out now where they beginning they get a condition when a multi-system organ damage they can get, we can get severe coronavirus. So yes, it's possible for let people get and me get. I don't see patients. In fact, one have been 9 weeks old when the mama test positive, the baby test positive, but they'll also be okay. Thankfully, they get better now. Also, if possible, and they can get it can deteriorate as well.
Fantastic.
Okay.
The last question of the night, Ish, before we get to you, Dr. Achmed, for actually sum up, is a much more important question. I think say it's significant for all put this as the last question. Waiting na the risk factor for them when we get other underlying sicknesses them like non-communicable disease them like diabetes, things that we've been touched on where you referenced earlier. But waiting at the risk factor, waiting at the seriousness for them people that they will get their underlying things like cancer, and why make the need for take coronavirus very seriously, as well as let them not afraid for this vaccine, because the question here today is about the vaccine. So why make it important for letting people and they based on their medical advices for letting take this injection?
So look, you make a very good point, and I use this opportunity for also say the vaccine not to give coronavirus, because the vaccine only gets a little bit of the virus in protein, not the bit of the virus itself where they cause the infection, just a little bit. So they get coronavirus. So number one, not afraid. But even more important, if you get the underlying illnesses and diabetes, chronic kidney disease, or you take treatments for cancer, or you take other immune suppressant treatments, and or in my own community, we get a lot of cases of sickle cell disease. These are conditions that way if you then go on and develop coronavirus infection, you not go do so well. You not go do so well. It not mean say you will always end up with a severe case of coronavirus, but if you look across board, the people that we can normally get admitted, where they admitted, they need a lot of oxygen. Eventually, they need intensive care and life support. Now, then people that we can get underlying illness, vast majority of time. So now patients are like that, members of the public are like that, we really, really need for go take the coronavirus, and the government in strategy based on that. The really, really high risk people, being really old, now high risk, and of course if you work with patients all the time, but besides that, the next group, now the one that we get underlying illnesses, sickle cell, diabetes, high blood, uncontrolled hypertension, on chemotherapy, on immunosuppressant drugs. They get others than at the list as well. So when they call you, just go for the vaccine.
Fantastic. So DJ Ish, I feel say Dr. Achmed, you've been fantastic tonight. I don't know whether Ish you get anything else for say to Dr. Achmed.
Yeah, I just get one last more question. How helpful the water, because people in the way they steam their face them regularly, like two, three times a day. Then they steam themselves, their face, put garlic, put ginger, put lime, then boil them, then they cover themselves with the towel. Then they only prevent them not forget the coronavirus, Dr. Achmed.
Well, look, I speak to a colleague where they work in intensive care, and we say, where they can get serious cases of coronavirus, then get something where they call proning, and this now then they turn you over, they turn over you for improve your breathing. And if you say, look, if you able, they try to take deep breathing exercise, so just anything where they help you lung function. Not to say they prevent you from getting coronavirus, but so that if you do get coronavirus, your lung function will be as perfect as possible. So steam inhalation can help with your lung function, help for clear your airways, but it cannot stop you from getting coronavirus. Not to something where I will say, yeah, do this, and therefore you will be okay, right? But if you get symptoms, you're able to clear your nose, you cough a little bit, it will help you for clear that mucus secretions a little bit better. And then sometimes will stop you for need oxygen level where it will need you for get admission in the hospital.
Thank you very much. DJ Little. Why? I know say get exclusive for me. As you see them so right? We don't ask Dr. Achmed so many questions and all that. And you, a prime example today where you self don't go take your own vaccine. How you feel about the vaccine?
Well, I want to say to all the one that we don't take them before me, especially the Sierra Leone community, I want to tell them thank you. One of the key reasons why I cannot be able to take them about 3 weeks ago, I go with my manager, and then based on the questionnaire where they present in front of me, I don't get a reaction to almond. So in the past, so as a result of that, because I comment on that, so the vaccinator advised me say, well, the best thing is not for take them. But following other guidance and the government review, and then we all they follow up, as Dr. Achmed say, the credible news platforms them, we see the health secretary himself and other panelists and professors them way. I watch a lot of TVs, and then I see say that was reviewed, and then for anybody where don't take where they get any reaction to any other what they call allergies, when no reference within the vaccine itself, then you are free, you understand, for take the vaccine with very little risk. So as long as the proteins or any of the chemicals which are referenced inside the vaccine not directly related to waiting you don't get allergic to, then you're free to go. So initially I be the hope say I will take the Oxford AstraZeneca, but the Pfizer one where I been declare say I get the almond allergy to. When I go back and then I speak to one of the senior vaccinators, he said, no, look, we discuss more, waiting at me allergic, any anaphylaxis reaction, we've been severe. I said, no, it was just a slight, I felt uncomfortable, my colleagues then noticed, and that was an isolated case. So that there could have been not necessarily because I they eat nuts, I they champ different nuts than the way I they eat. We are not ever get a reaction. But this now being a homemade milk, when an almond milk, when one of my colleagues they make them and bring a kind of work. So that's that I react to. So maybe other ingredients that Dr. Achmed could have added it. So basically, in a nutshell, I was advised to say, well, just take the injection. If anything, just report to your GP or report to A&E if you feel so. So I said, well, there's no point in putting it off and procrastinate anymore. Let's go forward. And I was inspired by my brothers, them, my sisters, them. We don't take them before. And I'm in a position as infection prevention control practice facilitator where they communicate the language, where they educate others for say, well, I've done it. You understand, in confidence by not having that hesitation. So I want to say that's the reason why. And I'm glad it's so I take today.
Oh, thank you. Before I go to Dr. Achmed, I just want for wish Wio's sister, Aisata Sisejalo, a very, very, very special birthday today, where nice special day for it's rather unfortunate to enable celebrate, to enable meet. But happy birthday, Aisata. And Dr. Achmed, I will read the last word for let you. I mean, like, just emphasize or just, advise me.
Yeah, no, thank you so much. I just want to say a huge thank you to you, DJ Ish and DJ Little, and Diaspora Voices for the invitation. And for we want to create this platform for Lewe will get this message across. I think it's really important for Lewe will talk with language where people in the talk. Slightly different from waiting in the area television. But look, you see, coronavirus in England, in general, don't go close to about 4 million cases, right? We don't vaccinate 4 million people. If you include the one that we don't get the second vaccination, about 4.5 million people. So will they get there slowly? but not left behind. People are still they get coronavirus. People are still die from coronavirus. The daily admission, daily deaths are still very high. Now statistics until it comes close to you, until you know somebody close, and sadly until it happens to you. So if you get an opportunity, forget the virus, forget the vaccine for the virus, go and take the vaccine. Until then, let we all continue for try and support research for follow the public health measures. So keep the social distance, and at most wash your hands. When you go out, wash your hands, wear your mask. And if you get for social isolate and do them properly. If you travel and come in and say quarantine yourself. And then look after you mind. Do positive things, exercise, eat healthily, take vitamin C and vitamin D. They're not going to prevent you from getting the virus, but they're going to boost your immune system and help you. And continue for stay close to the news, to the credible news, because things that they change all the time. You see, people can ask questions. Well, why the news they change so much on this, and they tell you say 1 minute you can come out and go to the next minute. Now because the evidence they change, and we get the opportunity within our country where we get very, very good science system, we get very, very good laboratories, we get very, very good hospitals, and we'll not take them for granted. We'll follow the advice. Yeah. So together we can do it.
So you still encourage people for take the vaccine, because now you don't take them, but now you said you give people them now.
No, absolutely. And the sad thing is, the soldiers and why they will get a very ethnically diverse population, but the people and where they come forward for the vaccine, not so an ethnically diverse people, and they come, so you see the disparity. Say, well. Let's say if you get 20% black people and 10% Asian in the population, 70% white, you go expect the same proportion of people for come forward for the vaccination. But sadly, that's not the case. You get significantly more white people and Caucasian people where they come, much less black people and where they come. When then tell you say the amount of agony where they don't go through, the amount of see where they causing them, brothers, sisters don't tell them, say, hey, you go take that vaccine there. So we just get for support research, and I think for the one that we cannot take the vaccine and they show them na social media, not a bad thing, a very good thing, not so for show off, but I just give courage to other people and for say, look, we don't go do it. So if you see the queen or the queen in man don't go do it, you say, well, I'm not happy them, they're different from me. But if you see DJ Little don't go take them, if you see me don't go take them, you see somebody else where you know that the community don't go take them, you're able to relate more. So well, if you don't go take them and they're okay, that means the chances are myself will be okay if I go take them.
Okay, on that lovely note, I want to play the video before we release you, let you go, and then Ish and me go round up. And where you reference that, today I go take the video and just for put them out here, and this now I get the confirmation and the clearance from my own place of work. We're now a very local hospital now, and then the people that were responsible, what would they call corporate communication, the boss of the boss, instead watch them, they don't give me the all clear. So now just a short 30 seconds clip. I hope say people them. This again, Dr. Achmed, I thank you for where you reference that. This not for show off, this not for boast, this not for just raise awareness and calm the fears down of we brothers and we sisters them. For say, yes, me don't take them. You said able take them, Dr. Achmed take them, I said Jalo take them, he put them out here, and all the other healthcare professionals they will do. It's not a boasting thing, it's for support. If Wetman they do them, we see Joe Biden go out here, he roll his sleeve, he take them. You understand? We seen celebrities there across the country, they don't take them. Let we say we all local champion them, people that like me, people that like Dr. Ahmed, people that like Isata and all the other healthcare workers them. Equally, if you feel say you want to do it in a private, we still respect you. But if na phone call you will reach out to your brother and sister and say, I don't go take them, now for go take them. That all now help for push the positive message for let we turn that 28% of black people compliance to and flip them to at least 72% of black people compliance. We're in the statistics right now. So we can't turn the 28% to 72 because remember, over 46 to 60% of black and Asian ethnic minority now they died first now wave 1 and we're still severely affected. We they see on front line. Dr. Achmed they see on front line. So we they see so we're not isolated. So do whatever you think, whatever you say, take this vaccine and we'll allow watch this short clip video and then we go just summarize and then we'll say we allow Dr. Achmed for say tata. Okay, listen for our people. I'd like to get my first vaccine. The support the roses for some immunity and when I for them say yes, then no need to fear. We're here. Okay.
Just relax here, okay? Finish. Fantastic. Well done. You hold that for me. Congratulations.
Thank you very much. Brilliant, that's it, Dr. Achmed, and that's it. Just a short clip there for we all foresee, and when I all don't see say yes, I don't take them. So thank you, Dr. Achmed. Thank you for inspiring the community. Thank you for inspiring the nation, and thank you for inspiring the diaspora, the world, and thank you for accepting the invitation. God bless you, sir.
Thank you very much, Dr. Achmed. Thank you. It's a privilege and it's an honor for getting at this platform for educating we not get a knowledge over this thing. Thank you very much. Thank you. I know you get any last word you want to say to the community, to the people there before you go?
Well, just a huge thanks for all my way on tuning today. And when I said, hopefully go around and spread the word. For say, COVID is real, but the vaccine is effective and safe.
Thank you. We'll leave you now and we'll catch up with you again for more updates. Thank you very much, Dr. Achmed. Thank you
so much.
All right, people, as we don't say thank you. We get less than 15 minutes to go, and for round up the program, we get an extended program because it be necessary for let we put this program to una today. And again, and we hope say una all don't become well informed. Dr. Achmed don't answer all the questions that we most of una they think about now in a small circle them between una family them, between una friends them, and we hope say una don't get the information or some of the answers they wanna need. But equally, if una want to go back and watch the program and want to go through some of them questions there in respect to Dr. Achmed in the answer wegi, una can always go back and watch the program either on the Facebook page when a Diaspora Voices SL, or in the next few hours it go there available na YouTube for una when get Facebook, when I go able for watch them again na YouTube. Again, the account na Diaspora Voices SL. Una please feel free for subscribe na we YouTube page, like and share, and then on we Facebook page una can also like and follow we on Diaspora Voices SL. That way they will go all go able for spreading news. But today we got a very special happy birthday way Ish touch on when Isata Sisejalo, when the CEO of the Health Show Partnership Program. We want to wish him a very blessed happy birthday, and we wish him bountiful returns, and let God continue for protect him. We get a very surprise video where one of we brother them when brother Ibrahim Mustafa Fofana when IMF sent to me for surprise Asata. So that go be the last video we go play for him, and we hope say if anybody they watch now, if Isata they watch now or anybody they watch now, Isata no they watch, when I give Isata a call, say in brother when a brother IMF don't send a video to the Diaspora Voices where they can play for him, we go be we outro video. So DJ Ish, I want to say fantastic job well done again today, and I want to say thank you to we brother Koke Moba, we constantly they update we Ruby Woo, we update we about the sound volume we been low towards DJ Ish and Dr. Achmed. We apologize again for now. I'm Tona. As we say, it's a work in progress, and we don't there by the end of this month when we first full 4 weeks. Everything go down there perfect in plan. But as you say, we tell Una thank you. For all we viewers that will join we, Boku thank you. Next week on Diaspora Voices, we get one of the most anticipated program them where we they talk about now one of the things that they run different series about. We call them Men in Business. So this time Men in Business will be here talk to we restaurant owners them. Next week Men in Business we they talk to the brand designers them. So DJ Ish, I just want to ask you Lily opinion. What brand designers mean to you, especially man the way they design their own brand? Briefly, what do they mean to you?
Well, first and foremost, now a big step where somebody sit down, they don't look at it, they buy clothes other side, they buy other designer then, they wear them, then it decides saying anything. It's about time la make me young brand, you know, and you go to ask different opinions them, and it's a lot of work, a lot of hard work. So I respect them guys there for the work where they do, because not so easy something, you know, for Sidom and Senating. Now I decide to make my own DJ Little brand, and not for only make them. Imagine you don't put so much money for make the brand, and then how for push them to people and now for let it reach them. That's another fact, you know. So it's not easy, but when you get to that platform and decide generating and they do this, then before you know it, you don't establish. So I mean, them guys do very well in the community.
Well done.
And they look forward for getting them at this program for them can tell we a lot more for what we learn. You know?
True.
So
Thank
people,
you.
this is the surprise for now. Next week.
Yeah.
We'll
Also on the Tuesday, we get we sister them where they come J's where they can talk to me about them brand new initiative where they set up a business. So next week we get a program on Monday and Tuesday. So we get with sister them a young lady where they work at the healthcare sector where they set up in your own business where they hopefully for one a nursing agency. And I hope say una will join me the Monday and the Tuesday. And una also not forget say Diaspora Voices SL. They are so on Sundays with Evangelist Winston C. Weber with Sunday Good Word. And then Monday, me and DJ Ish, we also with the regular Diaspora Voices program. And then now and again, as we say, with the showcase we sister them, we give we sister them the platform on Tuesdays. So now so we do now and again. And also on Fridays, we hopefully go begin to get pre-recorded programs then for we Muslim brothers and sisters them where we go to stream later on in the evening just for pass the message what they call the Dahwa message. So that message they go to cancel now and we're going to get different various sheikhs them and different various brothers them and imams and also sisters them. We're going to help for communicate the Dahwa message and we're going to be on a Friday evening. So when I see we get plenty for now, but let us all spread the love and share, like and follow. So Ish,
on a Saturday, yeah. Hopefully the exercise program will come back in the evening.
I'm excited. I want that.
Yeah. So hopefully the exercise program will return back between me and hour. So we go update you now. The flyer will come out and the time it will be in the evening. Because since we're on a lockdown, there's so much going on and lots of people need to go outdoor for exercise. You know, so we decide for Duam, you can be home and do the workouts with we, you know. So again, viewers, we just want to tell you plenty thank you for una stay with we, for engage with we. Una thank you. Una continue for support our local network, Vision Television, when our Diaspora Voices. Una continue for support we. And feel free if you get your ideas and you get your brand where you want to be showcased, reach out to we can do them. We can book an appointment for you and then try to get your slots where you go come and showcase what you get. So please feel free for reach out to we. We just want to tell you plenty thank you DJ Little, I don't know if you get anything for say before we play Isata's video. When are the last one?
Thank you, everybody. Let us know, feel free to say. We also get a wonderful man. We go by the name of what do you call it? He goes by the name of Dr. Abdul Karim Sise. Dr. Abdul Karim Sise Godena Yaso, and he's going to talk about more understanding, more knowledge on coronavirus, and then they will happen sometimes next month. So now other good message than they and when they look. And one of our sisters they reach out to we say we get more doctors then. But because of the format of the program, we only bring one at a time. The message will communicate. It's today, imagine if we get 2 or 3 Dr. Achmed. We not go enjoy because they let them go all they pass the same message, then get different way of telling it. But when you get one person, he go tell the message well, and then hopefully you go able to take him. So we want to say, Isata say happy birthday to you.
Birthday to you, yeah.
And we hope say you enjoy the program. God bless you. And we are now going to play this song for you and play out. I want to say thank you to all we viewers them we watch the program. Continue for follow Diaspora Voices 7 days a week. Remember, on Diaspora Voices, DJs, what do I say on Diaspora Voices? Every voice matters.
Matters.
Indeed. Okay, people, stay blessed. Good night and farewell.
Kukuba I know one problem. 2021, all I need, give me success. 2021, I know one problem. I know one problem. 2021, all I need, give me good health. 2020 something about it, yeah. I thank God I survived, yeah. 2021 will be my own year. Please Lord, hear my own cry. I wanna be the head, not the tail. Lord, please bless me with the grace I expect from nobody. Lord, please be my own body. I did pray for well body, amen. I did pray for boku money, amen. I did pray for go overseas, amen. All my enemies go shame for me, amen. I did pray for well body, amen. I did pray for boku money, amen. I did pray for go overseas, amen. All my enemies go shame for me, amen. 2021, I know one problem, I know one problem. 2021, all I need, give me success. 2021, I know one problem, I know one problem. 2021, all I need, give me good health. Lord have mercy, I know one problem, no one problem. Lord have mercy, I know one trouble, no one trouble. Problem go away, eh. Trouble go away, eh. Sickness go away, eh. Temper go away, eh. This year I must make up. This year I must get me on Range Rover, eh. This year the show go right. This year I must go overseas. Lord have mercy, Lord have mercy, Lord have mercy, Lord have mercy, oh yeah. 2021, I know one problem, I know one problem. 2021, all I need, give me success. 2021, I know one problem, I know one problem. 2021, all I need, give me good health. 2020 something about yeah. I thank God I survived, yeah. 2021 will be my own year. Please Lord, hear my own cry. I wanna be the head, not the tail. Lord, please bless me with the grace I expect from nobody. Lord, please be my own body.
Akrish on the mix.
Country. This puts many people at risk of serious disease and is placing a lot of COVID-19, especially the new variant, is spreading quickly across the country. This puts many people at risk of serious disease and is placing a lot of pressure on our NHS. Once more, we must all stay home. If it is essential to go out, remember, wash your hands, cover your face indoors, and keep your distance from others. Vaccines give clear hope for the future, but for now, you must all stay home, protect the NHS, save lives. COVID-19